Hello and welcome to Positively Thriving, a podcast for people living with HIV by people living with HIV. This podcast is brought to you in partnership with ViiV Healthcare. My name is Tom Hayes and I've been living with HIV for 9 years this year, and I work for the charity Saving Lives. I'm joined today by two incredible women who are here to share their experiences and insights into life, love and the future with HIV. To my right, I've got Sam. If you'd like to introduce yourself and tell us maybe what you've been up to recently.
Hi everybody, my name's Sam and I'm from Bournemouth and I currently manage Body Positive Dorset. And something exciting I've been up to, let me think. Okay, lots of sex with a Tinder date.
Ah, you swiped
Yeah.
right.
Yeah, I swiped right. I got fed up of swiping left, so I actually found somebody to swipe right with. And yeah, that's been going really well actually, so all good fun.
I'm glad to hear it. And to my left, I've got Susan.
Hi, I'm Susan. I work for NAM AIDS Map, the HIV information charity. I've been living with HIV for about 21 years, and I'm like well jealous of Sam. Yeah, you go, girl. In terms of something fun that I've been doing, let's see. Oh, on Wednesday I had the VIP experience at Phantom of the Opera. It was absolutely extraordinary because I did a talk recently to actors at Her Majesty's Theatre, and as a thank you, I got incredible seats for me and my mum and my two younger kids, and we even went into the VIP room at intermission that had Princess Diana's special toilet that she used to use with gold wallpaper made of like real gold leaf. So that was awesome. My kids were like, oh my God, my bum's been somewhere that Lady Di's had her bum.
My whole face then was in awe of that story. That is amazing.
Good Lord. Awesome. Thank you for both for being here today. So in 2020, women account for more than half of all people living with HIV. And worldwide, HIV remains the leading cause of death for women aged 15 to 49. International Women's Day was just passed on the 8th of March, and today we're going to be focusing on the issues affecting women living with HIV. So Sam, you said you were diagnosed in 2007, was it?
Yep, that's correct.
Could you share some of your diagnosis story with us? Was it a big shock to you when it happened, or is it, something that was on your radar?
No, it wasn't actually on my radar. I unfortunately I picked up an STI from just having rebound sex, strangely enough, and
We've all been there.
yeah, I thought so. And I went to the clinic, and I was 40 years old, so I'm thinking, I've kind of lived through the 80s and the 90s, have practiced safe sex, maybe not all the time. Yeah, what the heck? Let's have an HIV test. And a week later, huge, massive shock when they actually told me, yes, I was HIV positive. And I think for about the first 3 to 5 years, actually the first 3 years I really fell apart. And then about 5 years into my journey, I met a group of women. It was actually at the time called PosFem. And for me, that was a massive pivotal point in my journey because that made me be able to turn my life around and to become a woman living with HIV rather than the other way around. So, for me, that peer support was a massive part of that journey. So that's now enabled me to have the strength to be an advocate for other women, but also looking after the wider community in Bournemouth and surrounding areas.
Amazing. And so that was 2007. That's 13 years ago, 20 by maths. Susan, you were diagnosed 21 years ago whilst you were living in America?
Yes, that's right. I recently got married to my second ex-husband.
Two of how many?
I've had 3 so far. I collect ex-husbands, a bit like shoes and handbags. I probably got some shoes longer than I've had ex-husbands. So I had an HIV test through a routine immigration test in Louisiana where my husband lived, and it didn't cross my mind for a moment that I could be positive. And I'm from Croydon, a very boring suburb of London where nothing ever exciting really ever happens. all I knew about HIV was very much the Don't Die of Ignorance campaigns. And, I really didn't think that it was something that would affect anyone like me. And the way I got my diagnosis was initially the doctor said, well, the good news is you don't have syphilis. And I was like, yay, no syphilis, which
Hurrah.
is
Days.
hurrah. But the bad news is you're HIV positive. And that was an extraordinary shock. And because I knew so very little, I said, well, how long do you think I've got to live? Because at the time I had 2 kids, and they were about 4 and 6 at the time. And the doctor actually said to me, about 7 years or so, which was absolutely ridiculous because there was effective
Yeah, it's
combination.
99. So.
Yeah, there was proper combination therapy then. And I mean, my coping mechanism was to actually find out everything that I could about HIV. And even though I was in Louisiana, which is sort of an interesting place,
I can imagine.
I got information from NAM AIDS-MAP, where I'm working now. And I realised that actually that doctor was talking nonsense. And for me, finding out everything that I could about HIV and about treatment was enormously helpful for me, because I think very much that knowledge is power where it comes to HIV. And also, I mean, I got support from Positively Women as well. Did you
Snap.
as well?
Yeah,
Yeah.
Pos Women was the point for me where I just saw this. The only way I can explain it is walking through like double doors and seeing like this whole massive group of women that I knew, were all living with HIV, but it's such an array of people and experiences and ages and nationalities. And it was, I'm still, half those people now I'm still friends with.
Absolutely.
In fact, I'm going, after today, I'm going to visit one of my friends for the weekend. And without that peer support, I don't actually know where I'd be right now.
Absolutely.
Definitely not here.
Yeah, no, I absolutely agree. Because I mean, I was in Louisiana, but then I had information sent over. But when I came back to the UK, Positively Women was extraordinarily important for me, and peer support, and having that support from other women who actually can understand what we're going through
I
is
hear that.
it's so important.
It actually makes me feel really emotional when you're talking about it now.
Yes.
Like thinking of all the different women I've met over the years and how I don't know, it's almost like you become family.
Yes, that's exactly
Yeah.
it.
So it's like I
That's
have
what I
this
was gonna
huge
say.
abundance of sisters.
Yes.
I've got 2 brothers
Yeah.
where I live in Bournemouth, but across the whole of the kind of like the UK and maybe parts of the world, I have this huge family of sisters, which I
Yeah.
love them all.
No, absolutely. One of my sons works for an HIV charity now, Stop AIDS, and
Okay.
he was at the international conference a couple of years ago, and he said so many women went up to him and said, "Oh, you might not have met me, but I'm your auntie." And
Yes.
and it was like
Yeah.
a network of
Yeah.
my sisters of women living with HIV.
Yeah, I love that family connection.
Yes.
It's amazing. So you've got 2 sisters with you today.
Yeah.
I do.
Yeah.
I'm very lucky. I mean, you're both very differently located in the UK. So, Susan, you're in Croydon, which you maintain as part of London.
That is the centre of London. Please don't diss Croydon, Tom.
And, we usually find you stalking around conferences in ridiculously pretty Louboutins.
Yeah, yes.
Whereas, Sam, you run a service in rural Dorset, and we're more likely to find you in a pair of wellies in a field.
That's very
How
true.
does that affect you being able to access services and the people you support access services?
I think it kind of makes myself, I feel quite isolated if I think about the peer, women peer support that I can get in Bournemouth or even Dorset, for example. So for me to access that, I need to have a kind of key on, your finger on the pulse type of thing. So, making sure you're keeping up to, date with Twitter and stuff like that, because that's where I see all that, the other stuff. I can watch things, I can hear other women, or by attending, women's weekends. I recently went to a women living with HIV and aging, which kind of covered a lot of the menopause. So, without that, I don't really know how I would have navigated myself through, what's been, a real roller coaster of a journey.
Mm.
So I think that's the only thing for me living in Bournemouth is being able to either look at social media or, like I said, travel to, London for it. It's normally London that I'm traveling to for that support.
Yeah, I mean, I think in many ways I'm quite lucky to live in London because I have so many choices where it comes to where I access my care. So, for instance, I live in Croydon, which is actually proper London, but I travel to Chelsea for my HIV care and had swapped from another hospital, and I have really easy access to to support groups because I think so many of the groups are in London. But like you, quite a lot of the support that I get comes from networks of women living with HIV, and I know that we're on some of the same WhatsApp groups.
Yeah, we are.
Yeah.
What those WhatsApp groups do?
Well, I see it as I suppose, as a safe space for women to stay in touch with each other without actually having to live next door.
Yeah, so it's informal peer support.
Absolutely. And also, we share information. I know I'm spamming the WhatsApp groups with links to NAM's resources. But yes, it's really a support network, but it's an empowering support network.
I totally agree. I'd say keep spamming. Without that spam, I would just be stuck in the hotspot of Bournemouth, which is, the town centre of Dorset. We do have nice beaches, people. I'd be lost, so keep spamming.
Okay, fantastic. Brilliant.
And moving on to another hot topic, almost literally. Sam, you mentioned the menopause.
Oh,
I am actually taking off my cardigan now as we speak.
By 2023, it's estimated that 20,500 menopausal women will be living with HIV in the UK. Meanwhile, a survey said that only 46% of GPs would be confident managing menopause in women living with HIV. Sam, what's your menopause experience been? And, has it been challenging because you've been HIV positive? Have there been barriers to your care?
So I went to a women's weekend and I actually learned that, in that process that I'd actually had a premature menopause.
Oh, right.
And
okay.
I wouldn't have known that without listening to, I can't remember the lady's name. She's an amazing doctor, does a menopause clinic in London.
Okay, sure.
And I learnt so much. But it was also what I found was difficult is how do you separate some of the symptoms that you may be experiencing? Is it menopause or is it, side effects of medication? Or if you've got other comorbidities, is it to do with those? And I think that's where maybe the GP struggles because it's almost like, how do they
Yeah, no, absolutely.
separate it?
Yeah, in terms of my work at NAM, I run workshops
I'd
for
love to
women
come.
living with HIV on different issues, and the menopause is something that comes up a huge amount of time and is a real issue. And that's very much what people are saying to me in relation to having symptoms and not really knowing if it's the menopause, is it HIV medications, is it just like aging generally, is it HIV itself? And women are so often ping-ponged between healthcare providers in
Yep.
terms of, going to the GP who says, actually, I think it's about your HIV care. You need to see your HIV consultant, who then says, no, actually, that's something for your GP to do. And then, when we get other conditions as well, we're sent to see specialists who then ping pong us back again. And it's
I don't want you.
yeah, it's a really dizzying experience. And there are questions that I think even the doctors aren't quite sure about at the moment. Like, for instance, are women living with HIV having symptoms of the menopause worse? Are we getting the menopause a little bit earlier
Yep.
than the general population? And it's a real issue. But it doesn't have to all be doom and gloom.
So, Susan, one of the questions I've heard is that sometimes women with HIV can't take HRT for the menopause.
I think that women with HIV can usually take HRT, but what I would say to all women is do check it with your healthcare provider just in case there are any interactions. There are also very useful apps like the Liverpool Drug Checker. And also you can go on to aidsmap.com where we have drug interaction charts. There's lots that you can be doing about it. So, for instance, some of the issues that women have are things like dry vaginas and
Great conversation.
and painful sex. But there's stuff that you can do about it. HRT
Yeah.
is can be really helpful. Even if you can't take HRT, there's topical hormones that you can take, and that really helps with the dry vagina side and estrogenize it. Is that a verb? Can you
I
estrogenize
think so.
or
It is now.
progesteronize your vagina?
Yeah.
So that could help so much. And I think, even though we might be getting older, that certainly should not be a barrier to having fun and enjoyable sex if that's what women are choosing to have.
Exactly. I learnt so much that weekend.
I think women are often embarrassed to talk about sex. And, the menopause is like one of those things that it's going to happen to all of us women. But it's one of those things that there just isn't enough of a conversation about. And there isn't enough of a conversation about sex as well.
Let's talk about sex.
And that's some of the issues that came up on AIDSmap Live. I host a live panel discussion about issues around HIV, and the last one we had was on HIV, sex and relationships, and within a week it's been watched by more than 20,000 people around the world.
That's amazing.
Congratulations.
Thank you. And I looked at some of the results, and the majority, more than double, were women who watched it.
I think that is so empowering. I think, I'm going forward, I'm thinking of how I can create a WhatsApp group, for women, peer-led. I'm going to try and connect it with the clinic as well. But then I'd be able to share, stuff. I'll be able to spam my WhatsApp group with your videos.
Excellent. Love
but
it.
I think that would be so amazing for people to be able to hear that and have that opportunity. But if they don't know it's there,
yes,
then they're not learning that they're not alone. All those symptoms they're suffering with. Actually, there's as we said earlier, globally, what was it, 51% of women living with HIV?
Absolutely.
So, you're not alone.
Yeah, and like even for me, I get like repeat urinary tract infections, and I thought that was something that was just happening to me. And then in terms of the sessions that I've been running, so many of the women who are attending are saying that they are also having that problem, and we all look around the table and kind of go, "Oh my God, I thought it was just me." And it's so important to actually share those experiences and learn from each other. So even though that I'm there meant to be like, teaching people stuff, I leave like learning an enormous amount from the women who are at the group.
Yeah, and I think you're so right. Doesn't matter what you can upskill yourself all the time. That knowledge of being powerful, you can just keep empowering yourself and learning as you go through your journey. And then hopefully, for obviously what we do in the wider community is support other women, to navigate through that really sort of unknown area of the menopause.
Absolutely. It's a real minefield. And I think sometimes it can be really helpful in terms of having a healthcare professional that we could use as a central figure to sort of coordinate our care.
Yeah, that would be amazing.
Yeah.
Susan, we know that women living with HIV are only included in about 20% of all research. How do we change this? And do you have any good examples of where women have been included or led research?
There's an absolutely brilliant piece of research called the PRIME study that's led by a number of awesome doctors who work in HIV. And that has some really important results in relation to HIV and the menopause. And it's so important. I think very often our experiences can be different to men. There was recently a news story on AIDSmap linked to the Prime study that specifically focused on the experiences of Black women living with HIV in the UK, and it was quite staggering because it demonstrated that in terms of older women living with HIV, Black women were more likely to experience emotional distress, but less likely to be offered support in relation to that. And I thought that was a really worrying statistic, but I was really glad that the Prime study have teased that out, and I'm sure there's going to be other wonderful, important gems that come from that study.
Yeah, I totally agree with all of that.
It'd be great to see more research into social issues affecting women with HIV rather than the studies previously, which have tended to view women as reproductive units. There's a lot of studies into the effects on pregnancy and on birth and on breastfeeding, but not so much on the social issues affecting women with HIV, especially the menopause. So I think if there are any researchers listening in, there's some great opportunities and some really important areas that need covering. Talking of the social issues that affect women, is it more or less difficult for women to share their HIV status with their friends and partners than perhaps it might be for gay men, do you think?
I don't want it to seem like it's. I think it's just mainly for different reasons, and I think like you said earlier, Susan, we don't want it to be all doomy and gloomy because we're living well with HIV, but there are certain experiences I think women may face more than men. So obviously gender-based violence being one of those. And I have my own personal experience of that. So, whether people like to say it exists or it doesn't, it actually does. Women have to, when you're talking to people about, to women about how to tell somebody you're HIV positive, we always have to talk about telling them in a safe space. Making sure you've told someone almost that you're going to tell someone you're HIV positive. And that makes it very loaded because then it sounds like you're going to be attacked just for telling somebody.
Yeah, absolutely. I'd very much agree with you. And also there's the whole issue about, actually, is it necessary to tell someone? I think even beyond safety issues, ultimately it's a matter of telling someone when you're comfortable to do so and doing it in the way that works best for you. And I think the U=U message that if someone has an undetectable viral load, they can't pass the virus on is quite helpful in that respect because if you have an undetectable viral load, you're not posing any risk of transmission to your sexual partner. So you have to consider the impact of that, and that can be quite helpful as well, I find, for many women in talking about their HIV status. So in a way that you can actually talk to your partner about the fact that you aren't a risk, and the reality is they're more at risk from people who don't know their HIV status than they are from us.
I sometimes wonder though if it's almost associated still with that part of women shouldn't have sex unless they're having babies.
Yeah, no, I know.
Yeah,
and that's
or we shouldn't have more than one sexual partner at a time.
It's such,
all of those things.
It's such double standards
Yeah.
where it comes to women, and it's really frustrating as well in terms of lots of reports and studies and focus on women living with HIV is always linked to reproduction because so many of us may choose not to have kids or may not be able to, so we need to bear that in mind. But I think you have kids.
Yep,
Yeah.
I've got 2 grown-up children
Yeah.
and 3 grandchildren.
Mhm.
So, but do you know what? I actually, if I think about it, I had my children really young, but what I realised, and especially through all of this journey, that being a woman doesn't naturally mean you're maternal.
Yeah.
Why is it assumed that just because you're a woman, you're going to have this maternal streak, that you're going to love babies, and some women, that's just not what they want. They want a choice.
Yeah, absolutely.
So, I mean, I'm lucky I had my children when I was so
Yeah.
young because, as I said, I had a premature menopause. So
Yeah.
I only had 15 years of, being reproductive. So I had a really short time of being
Yeah.
able to churn out babies. So only turned
How
out
many
2.
do you have? You have 2.
Yeah.
I've got 4.
4.
Yeah.
Okay.
Yes.
I'm the eldest of 4, so I
Yeah.
can imagine how challenging that was for you.
No,
Yeah.
absolutely. one of the myths that I find really difficult is that sometimes people think, because a woman has HIV, she can't have children, which
Yeah.
is absolute nonsense.
It's like we're selfish.
Yeah, it's absolutely ridiculous. When I was pregnant with my son, who's now 15, I did a naked cover of Positive Nation magazine.
I love that.
Heavily pregnant. I mean, it was brilliant because they airbrushed out my cellulite and
Is that still your
everything.
Facebook photo?
Yeah,
I'm gonna
kids will
Google
love
it.
that. And because I felt it's so important to show that women living with HIV can go on to have children, have HIV negative children who are going to be really healthy. And HIV should not be a barrier for living a full and healthy and happy life.
I totally agree with that. I got lost in that moment then because it was like I was almost like being empowered just in that moment of what you were saying, feeling that of how this message must feel to other women if they were listening.
Yeah,
Does that
no,
make sense?
yeah, absolutely. As a woman living with HIV, have you experienced any stigma in healthcare settings? Because I've heard so many experiences from women where we're more likely to experience problems there than anywhere else.
Yeah, no, I think you're right. I suppose my kind of experience personally would be perhaps maybe because I was a white middle-aged woman, being diagnosed HIV. Obviously, the question is, how did you get it? But then they normally proceed with, are you a sex worker? Or are you an intravenous drug user? So it's almost like, maybe I look like I don't have sex or something. I don't know. But yeah, it's always the further questions of why I've actually got HIV. So I don't want it to sound all bad because I do have good experiences, but I've had medication thrown into a hospital room because the nurse didn't want to come in. I've had a physiotherapist say he wasn't going to get HIV off my feet. I did offer him sex actually without a condom, but he and explained U equals U, and then told him that if he caught HIV off my foot, we were going to make millions.
Yeah.
But
That's,
yeah,
marvellous.
That's absolutely awful.
Yeah.
I mean, my first experience of HIV related stigma in that respect was when I had breast cancer a few years ago, and I had an oncologist ask me about how I got HIV, what I was doing to prevent passing it on to other people, and I complained about him and changed my care to another hospital. And similarly, after I'd had surgery, I was really lucky, despite having breast cancer, was that I had a breast uplift on the NHS as well. So every cloud has
it's just
a silver lining.
I'm echoing the
Yeah,
the breast cancer's not a great thing, but the uplift.
I can take my bra off now, and my boobs will just stay there. So
Jealous, mine. That's not happening with me.
Sam's just got a squeaky bra.
Yeah, I have a squeaky bra.
but the issue that I had when I had surgery, I came round and then I had a nurse come in and say, "Oh, I'm having a look at your records, and I see you take lots of medications. What are these medications for?" And there was a room of other women who just sort of like sat up slowly and stared at me, and I said, I suggest you go back, read my notes properly, and when you come back, we can talk about this. But it was hard even for me because I was in a vulnerable position, but this is my job and this is what I do. So when I think about the situation that other women are in, it's awful and it's so wrong. And from the moment of diagnosis, we're protected from discrimination, and we need to stand up for our rights.
Yeah, and I hear you exactly. It's like you just said, we're able to have that voice and stick up for ourselves, and even add a bit of humour to it, with a boob lift. But if you haven't had that experience of meeting other women, for example, you wouldn't know maybe how to answer those questions. Some people might not even go back to follow-up appointments, which obviously is totally detrimental. Another recent one was with nurses. So I suppose kind of touching on women where a patient, HIV positive patient, this is so awful, had a pen.
Yeah.
And the nurse went to give the pen back to another nurse, and they went, "No, I don't want that."
That is awful. And
This was like the last year or so.
This is from a session last week. I got told this.
a couple of weeks ago, I was running a workshop, and a woman shared with me an experience where she was in hospital, and the nurse who gave her her medication gave it to her on a spoon so she wouldn't have to touch her. The medication fell off the spoon onto the bed, and then the nurse scooped it up rather than pick it up and then did it again. And these are the things that are happening today still. I mean, fortunately, it isn't as bad
Yeah,
as it
I agree.
used to be,
Not as
but
bad.
it's still going on. And it's so important that healthcare providers are educated properly about HIV. And very often we're hearing about, GPs not being great. And they're a group that can really benefit for more education, although so many of them are brilliant, so I'm by no means
Yeah.
tarnishing all.
No, it's like you said. It's not going to. A lot of things have got better, and I've seen that in the humanisation classes that I run. So as they go
So
over
what's
the year.
humanisation?
Oh, so the humanisation days are with Bournemouth University, where they have second year healthcare students. So they, working in either hospital, GP surgeries, even surgery nurses, stuff like that, where we give them up to date information on living with HIV
Oh,
and how not to
brilliant.
discriminate against
Yeah.
somebody, not to treat them any differently, or not worry about their pen, or
Yeah.
not have to write extra precautions on their paperwork. But just that, with a little bit of up-to-date upskilling yourself, it doesn't take a lot, that you can just provide a little bit more care, which doesn't stigmatise and discriminate against somebody. And like we just said, that's meaning that a lot of women are probably missing cervical smears, for example. We're supposed to have them yearly.
Absolutely.
So if they've been put off by either their clinic or their GP, are they having those smears?
Absolutely. I agree with you, and I agree with you and the point that you made, that very often this behaviour comes about from people just not knowing.
Yeah.
So I'm trying not to use the word ignorance. I perhaps it'd be better to say a lack of education in relation to
that's
the
nicer.
a lack of education about the reality of HIV today, because HIV has changed.
Yeah, it has.
So if you could
definitely.
wave a magic wand and change the way people are perceiving HIV, what would that be? What would it be? A campaign, or would it be GP education? Would it be a celebrity coming out as HIV positive? Would it be something in the papers? What do you think would really impact the public and the healthcare professionals' understanding of HIV?
I think that's a really great question, and I think I wouldn't like to choose one of those. I think
Yeah.
All of the above.
all of the above. I mean, but in relation to a celebrity coming out with HIV, like a female celebrity, I think very often there's a pressure on people to come out about their HIV status. And I'm sure there are celebrities living with HIV who are female, but essentially that's their business. And if they choose to talk about it, it's up to them. But I don't think that they should in any way feel pressurized to do so. And we have some incredible positive role models of women living with HIV who are
Like
out.
you two.
Yeah.
You are.
Well, thank you.
Flatterer. But there are other great people like Joe Josh,
Yeah.
who is a trustee of the Sophia Forum and does the comms for the British HIV Association. And she's often on television talking about her experiences. And when people see a rather posh, slightly older white woman living with HIV, it sort of shocks them out of their complacency, and they realise that ultimately HIV can happen to anyone, and it makes it more pertinent to them when they see people that they can relate to, I think.
There are such amazing, powerful women, living with HIV who, without their knowledge, I wouldn't be doing what I'm doing now. People, from Pos Fem, like Silvia Petretti. I never say her name
Yeah.
properly.
Petretti. Sylvia Petretti.
Sylvia Petretti. That's it. She like that. I've always been in awe of that lady.
She is so glamorous.
Yeah, I know. I want to be glamorous sometimes. But anyway, that's really going off the point. We have some amazing real women who can do all of that
Abs-
stuff without having to be a celebrity.
Absolutely.
And they're doing it because they want to, not because they've been forced to.
Absolutely. And people like Angelina Namiba, who's
Oh,
my
I love her.
absolute ultimate heroine.
Yeah.
We spoke about her at the last AIDS Map Live, where we were talking about, the use of the word disclosure that
Her
Tom,
language use is amazing, isn't
what
it?
Tom brought up, where she said there's no good words that begin with dis. The only good word that begins with dis is disco.
I use that example in my education as well when we're trying to do language use.
Yeah, because I think, when we talk about HIV, if we use the word disclosure, it makes it seem like it's a negative thing.
An illegal requirement.
Yeah.
It's like heavy loaded, I always think that word. It's like, like you said, you're just going to give someone this like really huge secret and then it's like, what are they going to do with it? So if you just say,
Exactly.
I'm telling you something,
Yeah.
it takes away that kind of, sure my mum tells everyone anyway, hello, this is my daughter Samantha, she's living with HIV.
Yeah, so telling or sharing, I think, is much better.
Yeah, I agree.
A number of years back, the UNAIDS set a global goal, the 1990 goal. This is where the world is aiming to have 90% of people living with HIV knowing their status, 90% of those on treatment, and 90% of those on treatment with an undetectable viral load. We're now talking about a fourth 90, which is a good quality of life. If I could ask both of you what a good quality of life means to you as a woman living with HIV. Sam?
I think aging well, with no discrimination, which would be really nice, a great sex life, and not being judged for having a great sex life either. I don't know if I can think of anything else. What
Yeah,
about you?
I think it's a really big question, as you said. I think there's so many different elements to a good quality of life. I would say living free of stigma,
Yeah.
not merely surviving with HIV, but thriving with HIV.
I love that.
We're so lucky in terms of the fact that there are many different medications available at the moment, and I think it's really important for people to live well, that they're not being burdened by side effects from their treatment. So finding a treatment that works for you with the minimal or ideally no side effects. I think all of those things are really important. I think having a good sex life is important if that's what you want to have.
Exactly.
Ultimately,
About choice.
Yes, it's all about choice, and everyone's so different in terms of what they regard as important to quality of life. But I think it's brilliant that now we're looking at the fourth 90 and quality of life, and I think medical professionals need to consider that a lot more. There's so much more than the biomedics. We're so much more than our HIV status. We're more than our viral load and our CD4 counts, and they need to look beyond those tests and look at the human beings that we actually are and the unique women that we all are.
I echo that so much. That's so powerful. Because it's true. It really is true.
One of the clinics I work at asks their patients at the beginning of the year what they want to achieve by the end of the year, so they can measure whether they've achieved their quality of life goal. If there's one thing you could achieve by the end of this year, Sam, what would it be?
Well, strange enough, our clinic doesn't ask that question.
Well, maybe it should.
Yeah, maybe they should. So maybe I should introduce that to them. But I realise myself that the quality of life, for myself is really important. So one of my goals this year might not be that exciting for some people, but I'm aiming to go to Amsterdam. So I'm practicing self-care as my quality of life at the moment.
How about you, Susan?
Yeah, that's really interesting about going to Amsterdam. And there's a really important conference that's happening this year in San Francisco. So if there anyone listening out there that can help me get to San Francisco, that
I'll
would
go
really help
too.
my quality of life. But apart from that, I think that I would like to be healthier. I think that I would like to finally sort out the health issues that I'm having, because I think very often women living with HIV, we're not feeling well, but we just keep battling on and just keep on going and think, oh, I'm in pain, or I don't feel well, but I've still got work to do, I've still got kids to look after, I've still got the shopping to do. And I think it's a bit more self-care, and try and be in better health, and get more sleep as well
Oh,
will help.
I'm second that. That's definitely more sleep.
So something you mentioned earlier, Susan, was that you are not living with HIV, you're thriving with HIV. So there's Positively Thriving is the name of this podcast, so
Oh!
you did very well there. What does positively thriving mean to you, though? What is it to thrive with HIV?
I would say, for me, thriving with HIV is not being limited by the virus, and living my best life, essentially. I don't think that HIV in any way limits me. It doesn't define me. It just happens to be a virus that I have, and it's been positive in some ways, because I've made so many of my very best friends through the network of people living with HIVs, and the sisters that I have, like Sam.
Hell, I love my sisters.
And what does positively thriving mean to you, Sam?
I'm a woman, living my life, going on holiday hopefully this year, and practicing self-care. So, yeah, living my best life's the way forward.
Looking back, what do you wish you'd known then about HIV that you know now? Sam?
I think the instant thing I wish I'd kind of known at that point of being told was that I wasn't going to die. Because I just think it's that, that awful feeling. If I'd have known that, maybe it would have been a little bit easier at the beginning. But also, I think another big thing was that I wasn't the only woman. To me, I live in Bournemouth, so it felt like I was the only woman living with HIV in Bournemouth. So if I'd have known that then, I think things might have been slightly easier.
I wish that I knew that I wouldn't die in 7 years, like that stupid doctor told me I would when I was diagnosed. I also wish that I knew that it would be fine to go on and have kids, which I did, and that HIV wouldn't stop me from having a full and fabulous life, essentially.
So, final question to you both. If you were to meet a woman that's just been diagnosed with HIV today, what would your one message to them be?
Sounds a bit corny, but I would say you're not alone, because you feel alone, but you're actually not. There are other women out there living with HIV, and accessing peer support, because I know it worked for me. Give it a try. It'll probably work for you too.
And Susan, what would your one tip be to a newly diagnosed woman today?
I would say get information, because knowledge is power. I would recommend going to AIDSmap.com, the HIV information charity, where we have a wealth of resources at various different levels, and news stories, and really useful fact sheet about the menopause. And if you don't want to read written resources, check out AIDSmap Live on NAM's Facebook and Twitter pages, which is a really fun and informative way to find out about HIV, and it's a right old laugh as well. Don't worry, you're going to live a long life, so buy some moisturizer of a really good quality, because you're going to live a really long time and have a full life.
Well, thank you both for being here. That's it for today's episode. Don't forget to subscribe if you haven't already. You can find Positively Thriving on Spotify, SoundCloud, livelife.com or YouTube. Thanks and take care.